Welcome to the first mini lecture of this course. You already know tissue. You know how to fix it, process it, section it, stain it, and evaluate what comes off the microtome. What I want to do in this series of mini lectures is not teach you histology over again, but change the question you bring to the microscope. In clinical work, you ask, what disease is present so we can treat it? In forensic histopathology, the patient has already died. The question becomes, how and why did this person die, and does the tissue support that explanation? That shift in purpose is the entire subject of this course. So, let's begin. Let's make the distinction concrete. In clinical histopathology, your findings feed directly into patient care. A diagnosis of adenocarcinoma changes the treatment plan. The tissue serves the living patient. In forensic histopathology, the tissue serves a different master, the truth about how a death occurred. Your findings may be read by a medical examiner, a coroner, a prosecutor, a defense attorney, or a judge. They may help a family understand what happened to someone they loved. They may determine whether a death is ruled natural or homicide. That is a fundamentally different role, and it demands a different mindset at the bench. You are no longer supporting treatment. You are helping reconstruct events. We'll explore these different roles more deeply now. These three terms are used imprecisely, even by experienced clinicians, so let's lock them down now. The cause of death is the disease or injury that started the chain of events leading to death. For example, a gunshot wound of the chest or severe coronary artery disease. The mechanism of death is the physiological derangement that actually ends life. For example, exsanguination from the gunshot or a fatal arrhythmia from the coronary disease. These two can be confused because they sound similar, but they answer different questions. The manner of death is the legal classification, and there are exactly 5 options: natural, accident, homicide, suicide, or undetermined. Manner is not a medical finding alone. It is a conclusion that integrates medical findings with scene investigation, history, and circumstance. Histology can support the cause and mechanism, but it rarely determines manner by itself. Keep that boundary in mind. So let's look at a case to see how these terms play out. Here's a scenario to make this real. A person is found dead at the bottom of a staircase with a significant head injury. The cause of death is blunt force head trauma, the injury that started the chain. The mechanism is increased intracranial pressure from a subdural hemorrhage, the physiological event that ended life. But the manner? That is where it gets complicated. Was this a fall or an accident? Was someone pushed? So maybe homicide? Is the evidence insufficient to decide? Therefore undetermined? The tissue cannot answer that question by itself. The tissue can tell you the age of the hemorrhage, whether there was prior injury, whether the pattern is consistent with a fall or a blow. But manner requires the whole picture: the scene, the history, the toxicology, the witness statements. This is the case that illustrates why histology is powerful and why it is also limited. This week is about understanding exactly what piece of the puzzle you hold. So what can histology tell us? So what does histology actually contribute in a forensic case? Well, quite a lot. Gross examination at autopsy is powerful, but it has real limits. And this is where our field earns its place. Consider early myocardial infarction. A heart attack that occurred hours before death may leave no visible gross change. But microscopically, you can see contraction band necrosis and early neutrophilic infiltration that confirm the event. Histology can confirm sepsis by revealing microabscesses or bacterial emboli in organs. It can identify fat embolism or bone marrow embolism in the lungs, a finding that tells you the person survived long enough after a fracture for emboli to travel, which has significant implications for timing. It can reveal the vital reaction, the inflammatory response that only occurs in living tissue, which tells you whether a wound was inflicted before or after death. And it can show the cellular effects of drugs and toxins that toxicology alone may not fully characterize. In many forensic cases, histology is what converts a working hypothesis into a supported conclusion. But it's also important to understand its limitations. Just as important as knowing what histology can do is knowing what it cannot do on its own. A slide does not know the scene, the toxicology screen, or the witness statements. And critically, postmortem change like autolysis and artifact can mimic or obscure real pathological findings. A decomposed liver can look like fatty change when it does not. So forensic histopathology is never practiced in isolation. It is one voice in a conversation that includes gross autopsy, toxicology, and clinical history. And your job as the histotechnologist is to make that voice as accurate and honest as possible. Let's look at how postmortem change challenges that work. So I want to pause here and speak directly to your role as a histotechnologist, because postmortem changes start at the bench, right? Autolysis begins the moment circulation stops as cellular enzymes digest tissue from within. The rate depends on temperature, organ type, cause of death, and fixation delay. Pancreas and GI tract autolyze fast, while brain and heart are more resistant. As a histotechnologist, you control what happens to tissue once it arrives. Proper fixation and processing are the foundation of forensic accuracy, and that accuracy dictates the stakes of this work. Here is the part that gives this work its weight, and I want you to sit with it for a moment. In a hospital, a diagnostic error can often be corrected and the treatment plan changes. In forensic work, the stakes are different. Your findings may help determine a death ruling or whether a case goes to court. A slide can become legal evidence presented to a jury where someone's liberty or justice depends on it. That is why accuracy, documentation, and honesty are the core of forensic practice, beginning right at your bench. Now let's see how the lab work fits into the broader system. Before we close, I want to give you a brief map of where forensic histopathology sits within that system. A medico-legal death investigation moves from the scene to the gross autopsy and into the laboratory phase. The histology lab sits directly between the autopsy table and the final report. The slides you produce are what the pathologist uses to confirm or revise their gross impressions. Your output directly shapes the conclusions in the final report that enters the legal process. Understanding this system makes every decision you make at the bench more meaningful. Now let's summarize our core takeaways from today. Okay, first, forensic histopathology asks how and why a person died, not how to treat them. Second, cause, mechanism, and manner of death must be used with absolute precision. Third, histology reveals what gross examination cannot, but it remains one voice in a larger investigation. Fourth, postmortem change is a technical challenge that begins the moment circulation stops. And fifth, accuracy, documentation, and honesty are the absolute job itself. I'll see you in the next mini lecture where we explore the medical legal system in full. Take care.